For all of these reasons, I'm declaring a public health emergency of international concern over the global outbreak of novel coronavirus.
We're working very strongly with China on the coronavirus. That's a new thing that a lot of people are talking about. Hopefully it won't be as bad as some people think it could be, but we're working very closely with them and with a lot of other people in a lot of other countries, and we think we have it very well under control.
There is no reason for measures that unnecessarily interfere with international travel and trade. We call on all countries to implement decisions that are evidence-based and consistent.
We've never done it before. We closed our borders to certain areas. It's never happened before where we did that. We never closed our borders, but we did it, and we actually did it early, and we took some criticism. Now everyone's saying we did a good job.
Vaccines and therapeutics are not silver bullets, and they will take time to develop. In the meantime, there are simple things everyone can do. Wash your hands regularly and cover your nose and your mouth with your elbow when you cough or sneeze. That's the personal hygiene. If countries invest now in prevention and research, we can avoid more cases and more costs down the line.
So you're talking over the next few months, you think you could have a vaccine? You won't have a vaccine. You'll have a vaccine to go into testing.
All right, so you're talking within
A year, like I've been telling you.
Well,
A year to a year.
Lenny is talking about 2 months.
And we would be there in June.
But a virus can have more powerful consequences than any terrorist action. And that's true. And if the world doesn't want to wake up and consider this enemy virus as public enemy number one, I don't think we will learn from our lessons.
It's a little bit like the flu. It's a little like the regular flu that we have flu shots for. And we'll essentially have a flu shot for this in a fairly quick manner.
For the moment, we are not witnessing the uncontained global spread of this virus, and we are not witnessing large-scale severe disease or death. Does this virus have pandemic potential? Absolutely, it has. Are we there yet? From our assessment, not yet.
There have been no deaths in the United States at all. A lot of that's attributable to the fact that we closed the border very early. Otherwise, it could be a different story. So we'll just keep doing a good job.
Now that the virus has a foothold in so many countries, the threat of a pandemic has become very real. But it would be the first pandemic in history that could be controlled. The bottom line is we're not at the mercy of the virus. WHO has been assessing this outbreak around the clock, and we're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
Today, the World Health Organization officially announced that this is a global pandemic. We have been in frequent contact with our allies, and we are marshaling the full power of the federal government and the private sector to protect the American people. The virus will not have a chance against us. No nation is more prepared or more resilient than the United States.
We call on all countries to remove financial barriers to care. If people delay or forgo care because they can't afford it, they not only harm themselves, they make the pandemic harder to control and put society at risk.
We want to look into it. World Health Organization, because they really are, they called it wrong. They called it wrong. They missed the call.
The focus of all political parties should be to save their people. Please don't politicize this virus. It exploits the differences you have at the national level. If you want to be exploited, and if you want to have many more body bags, then you do it. If you don't want many more body bags, then you refrain from politicizing it.
Today, I'm instructing my administration to halt funding of the World Health Organization while a review is conducted to assess the World Health Organization's role in severely mismanaging and covering up the spread of the coronavirus. Everybody knows what's going on there.
They said that tackling this disease together is our only option. I couldn't agree more. The way forward is solidarity. The rule of the game is solidarity. Solidarity at the national level and solidarity at the global level.